Estimated there are 1 million LGBTQ plus veterans from our armed services. Now, you may not know about a program geared to provide care for these vets. It's called Pride in All of Who Served. Dr. Tiffany Lange, clinical psychologist of the Veterans Health Administration, joining us to tell us more about it. Thanks for coming on.
Thank you for having me.
Well, it's a new program. It started in 2018. Explain how this program actually works, Tiffany.
Yeah, so the Pride in All Who Served program, or the Pride program, is designed for our lesbian, gay, bisexual, transgender, and queer veterans. It's completely focused on discussions of why sexual orientation and gender identity matter in healthcare, and then empowering our LGBTQ veterans to get engaged in the services that will help promote overall wellness, social connectedness, and reducing certain healthcare disparities.
Well, let me bring this up because openness about being gay, LGBTQ plus in the military has become, it's more common now. But do you feel that there is still this big hurdle for the LGBTQ plus community to overcome while they're still serving?
Yeah, and I think that speaks to the larger LGBTQ community as well and the coming out process. And so what we know in regards to the research is that LGBTQ individuals who come out and receive welcoming support are less likely to commit suicide. And then for a number of our LGBTQ veterans, they may have served during a time when they couldn't come out for fear of harm, being kicked out of the military. And that legacy still exists today. And a number of LGBTQ veterans don't realize that the VA is separate than the Department of Defense, right? And so having conversations about sexual orientation and gender identity, it matters.
Yeah, because I could see veterans coming out now after the fact and trying to find a way to fit in. How many veterans have successfully completed the program?
Yeah, so we're at 32 facilities now and constantly growing. And so the estimates are that 500 LGBTQ veterans have participated and benefited from the Pride program.
Not bad. It's pretty good. It's because it's starting with 2018. What's the feedback you're getting from these vets coming out of the program?
Yeah, so the data trends are showing a reduction in depression, anxiety, intent to commit suicide, also a stronger sense of identity, who they are, better perception of the VA. But beyond the numbers, veterans are saying, had I known about this program, I would have come to the VA years earlier. And as a result of participating in the Pride program, I no longer want to kill myself. Well, and so overwhelmingly positive and impactful feedback.
And I'd say if more veterans, or if anybody hears about the program now, maybe you might have more people joining the military in the first place. How do veterans, if they want to get help and they would like to join Pride in All Who Serve program, where do they go?
Yeah, so LGBTQ veterans can go to va.gov and they can locate their local LGBTQ veteran care coordinator. And so there's at least one point of contact at every facility for LGBTQ veterans across the country, and that person can help them access and get connected to services.
Love it. Dr. Tiffany Lange, clinical psychologist of the Veterans Health Administration. Thank you for coming on, bringing awareness for our LGBTQ plus community.
Thank you so much for having me.
Is there a story you think we should investigate? Call our Eyewitness News tip line at 869-2929.